Well, welcome everyone. I think we're pretty much ready to go, just on 2 o'clock. So my name's Professor David Lindsay, and I'm a member of the RMEC committee and an academic within the disciplines of nursing and midwifery here at James Cook University. And I'm speaking to you from Townsville in sunny North Queensland. Before I go any further, I just want to acknowledge the country that we're meeting on today. So I'd like to acknowledge the traditional custodians of the lands on which our institutions and communities are located and where we conduct our business. We pay deep respect to ancestors and elders, past, present and future. We're committed to honouring First Nations peoples, continuing connection to land, waters and culture. So on behalf of the Australasian Mental Health and Higher Education Collaboration, that's RMEC, the organising committee, I'd like to welcome you to the second webinar in our 2021 series entitled The Tapestry of Mental Health in Higher Education. I'd just like to give you a little bit of background about the collaboration and tell you a little bit about our journey just before we proceed with the webinar. The Australasian Mental Health and Higher Education Conference, as it was originally known, was established in 2017 as a community of interest in Townsville, Queensland, in response to the increasing need for action in the area of mental health and wellness in the higher education sector and the broader community. Successful conferences were held at JCU in 2017 and 2018, and the RMEC group also forged a link with the editors of the International Journal of Innovation, Creativity and Change for special editions in the area of mental health and wellness in the higher education sector. This collaboration is ongoing and will continue to provide an important avenue for the dissemination of research from this group. In 2020, the RMEC group expanded its reach, forming a joint collaboration between James Cook University and the Australian College of Applied Psychology, ACAP, and you can see their little icon just behind me, to host a successful webinar in the midst of the COVID pandemic. This year, RMEC has broadened its vision, its goals and its strategic intent, so that it will be better positioned to engage more effectively with the many mental health and wellbeing issues confronting staff and students within higher education across Australia. In webinar 1 held in July, presenters Professor Stephen Naylor from JCU, Professor Rachel Field from Bond University, and Vivian Brown from Origin provided rich and enlightening sessions that focus upon just some of the many mental health and wellbeing challenges faced by academic staff within contemporary higher education settings. Closely interwoven with these issues is the Australian University Mental Health Framework, launched by Origin in December 2020, which, to quote Vivian, applies a whole of university settings-based approach to creating and supporting learning environments conducive to good mental health and well-being. The framework also identifies a clear role for the mental health sector to work in partnership with universities, providing expertise and facilitating pathways to mental health care both on and off campus. Each webinar in this series will focus upon a different experience of mental health and wellness in higher education and the community: academic, students, professional and technical staff, and finally research. Today, our webinar focuses on the student experience, and we have a really terrific panel of speakers who will be presenting to you today. Today's webinar has a slightly different format to the previous one, in that the presenters will be responding from their own perspective to questions that have been posed to them. And these questions are: what role can or should universities play in facilitating student mental health and well-being? what role can or should government policy play in supporting student mental health and wellbeing? How has COVID-19 impacted your learning experience now and moving forward as students? And lastly, what strategies have helped students cope with the changing landscape of higher education? As mentioned, we have a number of really experienced presenters, and they are going to bring a fascinating array of perspectives to the topic today. We have Heidi Piper and student Priyanka Govender from Griffith University. They'll be followed by Adriel Burleigh from here at JCU, who will be followed by Larissa Silazar, who is also, at the moment at least, based at JCU. And finally, Dr. Fortunato Cristobal will be presenting with his team, and they have chosen to present a video to you, but they are online as well, and they'll have an opportunity to respond to questions about that. So it's wonderful to have Dr. Chris and his team from the Ateneo de Zamboanga Medical School in the Philippines, presenting their perspectives on our topic today. Now, throughout the webinar, of course, the chat is active, as is the Twitter feed. The Twitter handle is hashtag AMEC, so hashtag AMHHEC 2021. I'll just repeat that, hashtag AMEC, AMHHEC 2021 is the Twitter handle. But I encourage you to make use of the chat function. We have a colleague, Dr. Vicky Hutton, is monitoring the chat, and she will be picking up on your questions, and she will feed those back to me at the end, and I'll have an opportunity on your behalf to ask the presenters those questions that you put through. So please make use of that chat function. So we invite commentary and questions throughout the webinar from you. And we look forward to hearing what our presenters have to say. So let us begin. I would like to welcome our first speakers, Heidi Piper and Priyanka Govender, who will be presenting on international students, mental health and COVID impacts. They've got a dual presentation, so thank you, Heidi and Priyanka, for your presentation.
There we go.
Lovely.
Better.
Thank
Great.
you.
Thank you again. Hi, everybody. I'm Heidi, joined by our wonderful international student, Priyanka. We are really delighted to be asked to speak today about a topic close to both of our hearts, international students and mental health. I'm happy to make these slides available in terms of the informational links that are in them. So if any of you wish to follow up on information or look at the links in there, you can. I too wish to acknowledge the traditional custodians of the land from which we're speaking today, the lands of the Yuggera, Yuggera and Jaggera peoples, and pay my respect to elders past and present, extending that respect to all Aboriginal and Torres Strait Islander peoples. Just as a very quick overview, here's a bit of information about Griffith University. We are based in Southeast Queensland with 5 campuses between Brisbane and the Gold Coast, and a digital campus, which has been all important during COVID. Prior to COVID, international students made up about 19% of our international student body and are a very diverse community. As I know that we have participants from around the world today, I thought I would start a little bit broad in terms of Griffith and international student mental health. So student mental health has been an issue of really growing concern in recent years in Australia, and we've seen a reflection of this at all levels. So in terms of the questions of whether universities and government have a role to play, absolutely. So this is an extract from the Higher Education Standards Framework Threshold Standards. TEXA is the quality assurance and regulatory body for higher education in Australia. They conduct audits and they consider big issues of sector-wide concern, one of which is very clearly student health and wellbeing, including mental health. And you can see that reflected in this extract here in terms of what we are expected as institutions to be providing for our students. Beyond that, we have Universities Australia, which is our peak body for the 39 Australian universities. They too take up policy issues and issues of concern to all of the sector. David already mentioned, so they worked with Origin, the National Centre of Excellence in Youth Mental Health, a few years ago to develop a national university mental health framework, and they partnered with the organisation Headspace to provide and release a Responding to Suicide toolkit for Australian universities, because more and more we are dealing with these very significant issues, and there was recognition that all universities need help and that we will all benefit from approaches that are professional and united and consistent. This is from the homepage of Origin around the University Mental Health Framework, to provide you with a link to that. So this was released in 2020 together with a range of case studies to again provide resources to the universities in Australia to help work on their own mental health frameworks to support the mental health of their students and, for that matter, their staff. In terms of Griffith, we address student mental health and wellbeing in a number of ways, of course, ranging from policy through to practice. In 2018, a student mental health and wellbeing working group was formed here. I was very lucky to be a member of that, representing international students and internationalisation. The work that was undertaken led to the publication here of a student mental health and wellbeing strategy for the institution. Alongside this, we recognised that we had a really significant policy gap. We had a student misconduct policy, which is a fairly punitive policy, and that was how any cases of student misconduct were considered without taking into account the role of mental health and mental health issues that may have impacted on it. So as a result, we developed and implemented a new student wellbeing and safety policy, under which cases of potential misconduct or misbehaviour by students that are the result of mental health issues can be considered. And it's a much less punitive approach to how we manage that and its impact on a student's academic journey. In addition, we've worked throughout the process of developing these policies and developing this strategy to try to put into place very transparent and accessible information about the support that is available, both for students and for our staff who are trying to manage mental health impacts on students and what that means in the classroom and beyond. We continue to look for opportunities to embed this information and in all aspects of university life so that students have access to it and staff have access to it, because often it's one of those things they don't think about until they need it. And at that point, it's often a little bit late. So we have it embedded in classroom activities, right through to self-access resources and promotional events on campus and through all of the various student sites and the student portal for the university. Under that student health and mental wellbeing strategy, there are 7 strategic goals. So this is what we're measuring the success of the strategy against. And again, they cover everything from leadership and policy and how we promote these activities through to the actual outcomes for students in terms of us providing mental health support and helping our students to get access to the support that they need. It is very much a stepped care or a tiered model. So at the very lowest level, we start with the self-help and self-access resources and trying to work with all of our student community to look after their own wellbeing as a starting point, to not wait until things get really significant, to be looking after all of the aspects of their student life. So looking after their health, their diet, their exercise, all of those things that will help them to have better mental health outcomes. And then, as you can see, it steps up through the different levels of care that are available, from initial consultation through to full referral to specialist services off campus. And of course, what we aim for is to be doing very little at that level 6 of the stepped care model and having the biggest impact at level 1 and potentially level 2. We refer all students in all avenues that we can to an online health and wellness centre, which again is focused on all those aspects of managing their university life, engaging in activities on campus, looking after their physical wellbeing, but also helps to refer students to the various specialist services that are available. So those that are available on campus, so specialist counselling appointments, right through to crisis support off campus. And this has been a really key tool, and the development and the promotion of this to helping students, again, take those initial steps to being aware of the potential impacts on them of being a university student and helping to manage their own wellbeing. In terms of international students, my specialist area, there are a range of things we have in place that are specific to their support, recognising that international students have specific needs. Unlike most of our Australian students, international students are a long way from home. The majority of Australian students go to university relatively close to their home. So most of our Australian students who are on campuses with us have access to their normal support structures, their regular doctor, their regular medical services, family, friends, often working part-time jobs, etc. Our international students, in very stark contrast, are usually here away from family, away from extended family, often arrive alone, and it's part of our role to help them develop those support structures, those links and those networks. At our Tier 1, we have the Griffith Mates program, and Priya is one of our Griffith Mates. So this is a group of about 120 student volunteers, about half international, about half domestic, who've been at the university at least a year, and they help to provide an engagement program that enables new international students to settle in, to meet others, including Australian students, to continue to develop their language if they're non-native English speakers, and to have access to a whole range of activities that connect them with the community. These Griffith Mates are a really fundamental peer support network because they're often that first point of contact for an international student. We also have a team of international student advisors who are specialists in supporting international students, helping them navigate the complexities of a large Australian university and of the Australian system more broadly. Our advisors work extremely closely with the other support services around the university. They're often the point of referral. So we tell international students, if anything is a problem, if anything comes up, you go see an advisor, and they will work with them to work through their problem, identify where they can get the additional support they need, and then refer them on. Within our student health counselling and wellbeing team, we have all levels of support. Again, they strongly refer students to the online health and wellness centre and the resources that it provides, but also counselling. We have mental health nurses, and we have increased the number of resources we have in that space in the last 2 years. There are doctors and psychiatrists available on campuses, and we have complex case manager, recognising that some students present with very complex range of issues that need someone to be helping manage the different people that they're seeing and coming up with an integrated approach to how we support them. COVID. Of course, COVID has thrown a very big spanner in the works for all of us in every way, but a particularly significant impact on our international student community. When it first hit and Australia shut borders pretty quickly, we had a relatively large number of students stuck outside Australia. Within about a month of borders closing, a very large number of other students went home because at that stage, this was in April last year, I think everybody thought, well, by June, we'll be through this little crisis and I'll come back and I'll do semester 2 on campus. But of course, that hasn't been the case. Australian borders are still locked down. So we have a fairly large proportion, about 36% of our international student body studying with us from overseas. There were other students, of course, who couldn't go home or didn't go home and stayed here, who were impacted in the opposite way. They have been trying to manage without access to home and family. There have been some very severe financial impacts. International students in Australia have lost part-time jobs by businesses affected by COVID, and often their families at home have been hugely financially impacted by COVID. So they're facing very extreme financial situations. We've also had all of those other impacts of COVID with lockdowns, isolation. I think about this all the time because I have a 19-year-old daughter who started university last year at Griffith. She did 3 weeks of normal classes. She was loving her university experience, and bang, the university shut down. And all the time I reflect on the fact that she has access to me and the rest of her family, her dog, her own room, plenty of space, a lovely home where all the laundry's done, all the cooking's done, and she really just has to worry about university and work. Our international students are in exactly the opposite situation. In most cases, they've had to be completely self-reliant or reliant on their little community of international students. And it has been a really, really challenging experience for them. And again, those challenges for students trying to study with us from overseas are almost the opposite set of challenges from those who are here. The one overseas are trying to deal with time zone issues. We have students getting up at 4 a.m. to join classes and tutorials online because they don't want to watch the recording. They want to be part of that classroom experience. So, of course, what we have seen is an increase in mental health issues and consultations for our students because they are facing such a hugely uncertain and complex environment. This is a snapshot of international student consultations with our Griffith mental health services from 2018 to 2020. The orange bars represent 2020. And you can see in that post-COVID, April, May, June, July, that increase in the consultations for mental health. This increase happened alongside, as I say, a decrease in the number of students on campus. So it represents an even more significant growth than it would otherwise, because these are all on-campus consultations. Same thing with our international student health insurance provider. This is their claims data. The one in the middle are mental health claims, and we're seeing that same growth trajectory, a bit of a spike through to June 2020, again, with fewer students in Australia using those services. So it's a smaller number of students having more appointments. So we were seeing some real issues of concern that we are seeing reflected again in the last 12 months. What have we done? I think, like every university, we had to make a very rapid transition to online teaching in an effort to ensure continuity of learning and keep students on track academically. This was pretty stressful for both students and staff, and it had a big impact on both. And depending on the nature of the course, a business subject lends itself fairly well to online delivery, as opposed to engineering, medicine, dentistry, all of those programs that really require some kind of lab work or clinical work. There have been some really huge impacts. And I think for our students, while we're panicking about how do we deliver really high quality teaching and learning online, they're thinking, oh, this is going to delay my future. I had this plan for my life and this is going to hold it up. There was a very, very large financial impact. As I said earlier, the university ended up giving out more than $8 million in student bursaries last year, and $4.5 million of this was to international students. So the proportion of it that went to our international students for day-to-day support, to pay rent, to buy food, to pay electricity bills, was disproportionate to the number or the proportion of international students that we have here. But we recognised that it was really important. And we had support also from the Queensland government in this area. We worked with a number of food charities and the Queensland government to give out more than 12,000 meal packs to our international students during last year. And of course, we moved all of our international student advisor and health services appointments online. That was really important because they were needed more than ever as people tried to traverse this uncertainty. And I certainly saw the huge mental health impact of that on my staff, our international student advisors, who were really faced with what I called a tsunami of human grief last year. And that hasn't really abated. I think we've gotten a bit better at expecting it and managing it, but it keeps going because we have a very large Indian student community. And of course, there is probably not one of them whose family has not been impacted in terms of its health. Many of them who've lost family members during the COVID outbreak there, and it is similar for students from a range of countries that we have on campus. I added this in because an increase in student mental health issues necessarily impacts our academic community who are at the coalface with students, whether that's in the classroom or online. So very recently, our Deputy Vice-Chancellor Education launched a range of resources to support academic staff about managing this. It's everything from how do I identify and refer a student at risk? What do I do when I receive a desperate email? And I certainly have many of those forwarded to me, so I know there's been a big increase in those. And what do I put in my email signature and my out of office to set realistic expectations for students so they're not expecting an answer at midnight on a Sunday because nobody is able to work 24/7. And I think this has been a really important resource to help our academic staff do the best they can to support our students and our international students through this time. Our Griffith mates, I talked about them earlier, these are our superstars. They really are. They very rapidly shifted their program of activities online when COVID hit, and the majority of them, this is one of the rare ones on campus recently, but the majority of them continue to be online. And I think they've been a vital lifeline for our students, whether they've been here in Australia or overseas during the COVID period, during periods of isolation, to be able to connect with each other, to do fun activities, to know that they're not alone in this. And at this point, I'm really delighted to hand over to Pri, one of our students in Griffith Mates, to talk about what this experience has been like for her from a student perspective. And I'm going to try and get this camera working too.
Hi, thank you for that. So I actually had a meeting with Heidi last week, and I told her, look, I don't even know how to start. You know, this is such a big problem, mental health and international students. Where do I go from here? And she told me, just, you know, say your perspective, say what you've had to deal with. So a little bit about me. I am a South African international student, and I study biomedical science, and I've been in Australia for 3 years now. So I came in 2019, and what that means is that I had a year of normal university life, a year with COVID, and then now a year where we've kind of got a mix of the both. And what that means is that I've seen, you know, all sides of the coin as possible. And I've also worked with a lot of international students, new students as well as current students, and I've seen the struggles they've been going through as well. And it's so monumentally important that it's recognized that there are so many issues coming up now that maybe haven't existed for a lot of our students before. I've had first-year students coming to me and telling me, you know, I've got anxiety, I've got proctored exams where people are staring at me through a screen, you know, monitoring my computer. How do I do this? You know, students that are having anxiety and panic attacks for the first time in their life and not knowing where to go or who to talk to. Students that are away from home, haven't seen their families in 2, some 3 years. And I think about it and I'm like, it's the same for me. I went through COVID living in a studio apartment. It was just me. I had the support of family members that do live here and friends that I'd made during first year. But it made me think about, what about all these students that are just coming to uni now? They don't have that same support necessarily. I mean, all of my friends were made in first year, in-person events. You know, we got to go to uni bar together after class. We got to attend cultural festival, which is one of the big events that used to happen at Griffith. And I realized that without those initial chances to talk to people, I would never have made the network that I did. And it must be a lot harder for students that are just coming in now. You know, you have to make friends with people through a collaborate session. You know, everyone is watching class. Nobody's really chatting to each other. You're not getting the full experience of being at uni. And you feel a lot more isolated. And that's because, you know, you always feel like you're the only one going through it. You feel like everyone else is probably fine. You know, I'm the only person feeling this way. And that support is something you generally only get in person. You know, you go into the library and you see a few of your other friends having the toughest time with an assignment, and you know that it's not just you. But our international students that are still overseas or have just come to Griffith are still struggling with this. They don't know how to talk to people. A lot of events have been canceled. And it's amazing that, you know, there's still people that are navigating their way through this. You know, as part of Griffith Mates, we've had a lot of online events. So a lot of people will come to these, our trivia nights, our coffee catch-ups. And that's one way for them to kind of make that connection. But a lot of students are afraid to even take that first step. And I think it's important that universities and stuff focus now on, you know, how do we help these newer students, you know, get over these barriers? How do we help them make connections? And how do we help our current students or our older students who are dealing with anxiety, who are dealing with, you know, depression or feelings of isolation related to COVID? So I think it's really important that conversations like these happen, and I'm really grateful to be able to give my perspective. I'm very sorry for the technical difficulties that are happening right now, but I think it'll pass back to David.
Thanks very much, Pri and Heidi, for really laying a really solid platform for our further discussion and deliberations throughout this webinar. Heidi sharing some really wonderful pointers and strategies about the Griffith response to mental health generally, and in international students in particular, and through that COVID time. And Priyanka, I just want to thank you for providing that quite personal testimonial about your experiences and those of your student colleagues. So thank you, both of you, for that excellent start to our webinar this afternoon. Our second speaker is Mr. Adrian Burleigh. Adriel is a project co-facilitator here at JCU in Townsville in the College of Healthcare Sciences. Adriel's going to be responding to those 4 questions that I read through earlier on, and sharing his experiences and expertise in that particular area. Thanks, Adriel. Great to have you presenting this afternoon, and over to you. Thank you.
Thanks, everyone. My name's Adriel Burleigh from the JCU. I'm currently on Palm Island, which is a few hundred kilometres away from where David is at the main campus of JCU. I just wanted you to see my face, first of all, despite the little bit of a bad hair day, and then go into my presentation. So I'll just do that now. Okay, I wanted to firstly thank everyone for attending today. I had the privilege of being involved in one of these forums a number of years ago under a different hat, and it wasn't necessarily broadcast around the world. So I welcome all our colleagues from around the world today in listening in. I wanted in that regard to say something about what I'm doing and the relevance to that and student wellbeing for the people that I connect with in the community and also in the previous roles at another university. But I'm proud to be part of JCU in North Queensland, and obviously our campuses at Cairns and Singapore and other locations. What I wanted to do in this presentation is go to the points about the questions that were posed and put some context around what that could mean for you and your campuses around the world, your students or your colleagues. I'm mindful always that I'm recognising the lived experience of students, and that comes from a certain lens as opposed to letting them speak for themselves, so to speak. So I wanted to, as you can see, that's the theme of what I'm going to be talking about today. So my question to you, and you can consider this through the chat, I want it to be fairly interactive and answer it later or take notes for later, is what is your student culture, whether that's your international students or your day students or the students within your state or country. For them, what are the protective factors that keep them well? What are the pressure points that push them to the limit? And is what we're doing now, however well-meaning, is it fit for purpose? Is it fit for our times, in this case, COVID? And hopefully some things I can leave with you could do now that don't actually cost anything or aren't difficult to get going. I wanted to firstly acknowledge that I'm coming from an Australian perspective, and there's a number of experiences from around the world and including international students that are based in Australia I can't necessarily speak for. My role involves working with Indigenous First Nations students and community members that may wish to be students in the future. And there are similarities in their needs to English second language and cultural and linguistically diverse students around the world. In very much case, our colleagues online today, I am the foreigner, not you, and vice versa. So we need to keep that in mind when we think about things. Just quickly to point out, the Australian National Mental Health Commission did a thematic review with university students around Australia with 2 agencies that supported them. What they found for Australian students in their research was that the things that contributed to mental ill health were perfectionism, were high expectations on young people from parents, society, on at times themselves, and our colleagues from Griffith mentioned that. Trauma of varying kinds, new, old, and ones unrecognised. However, Australian students and Australian international students mentioned that the contributing factors to their recovery was self-acceptance, high quality therapeutic relationships, and that includes within their discipline if they're working in this field, and receiving some modicum of unconditional love from outside, from fellow peer students, from the institution themselves, which is a hard concept to get your head around. But really what that means is having an anchor person who held on to hope when things seemed difficult for them. So I pay tribute to our colleagues from Griffith in the sense that those student reps are holding space and holding a modicum of unconditional love for their fellow students. The question now is, are we fit for purpose? And that's no question for me, that's a question for you and your place. Is it fit for your times and things we can do? So I want you to share two little quotes from uni students that sent me stuff. One was an undergrad, a brand new 17-year-old. Another one was obviously a postgrad or trying to be. Now I'll let you read that. I don't need to read it. It simply says in too many ways that those different types of students were looking for a sense of acceptance and place within their campuses or faculty or whatever, to feel welcome. And that is very much the case for First Nations students of Australia. And likewise for international students when they arrive on this continent. So I want you to absorb that. I always do very simple presentations because people sometimes get wound up with taking screenshots of stuff. You can get this later as a PDF from JC staff. So the questions I want to pose for you to consider is think about in your student body, even brand new students or old students, alumni, whatever, what are they socialized to do? As in, what are their generational things, elements, as to why they interact with you as students, Gen Y, Gen Z, whatever it is, including their culture, and what is that they're socialized to know. Many of the young ones, they don't understand body language and facial contact because they've been in forever social contact through text message or something similar. Have a think about that in their approaches to whatever you decide to do. Where am I today? I'm on an island called Palm Island, as I mentioned, which is some 400 odd kilometres from 200 odd kilometres from the mainland, depending which way you go, off the coast of Townsville. Why I'm telling you this is that there are 40 tribes, 40 First Nations tribes that were brought to this island from 40 nations, if you want to look at it that way. I know there's some 20 nations on this Zoom right now. So all we need to say is there's no wrong answer for some of this. It's understanding what your culture is, both generationally, culturally, language, and all those religious norms and other things, political things that go into play that make it something you need to localize for you. I want to just quickly touch on a few things about those ways of learning and ways of help seeking your students may choose to use. I wanted to point out a bit of research, which will get you the link, from Movember Researcher, a big mental health charity in Australia, that talked about the fact that men in Australia, i.e. male students, often have a high dropout rate from psychological services. They come once, but then don't come again with high risks. So what we need to be considering is, whatever it is, it may not be a clinical service, it might just be what your faculty does and how it does it. Is it equitable for the ways in which male, female, LGBTIQ, different peoples with different religions and languages find that accessible? And if we don't, why, therefore, they don't choose to come again? And sometimes move universities. Situational mindfulness, obviously what's happening here and now to bring us in the present with COVID. Simple things, like assignment mindfulness. I mentioned about people doing assignments but not understanding how to communicate verbally and struggling with face-to-face stuff. Get them to handwrite it and take a photo of it rather than typing it, and the expression and mindfulness that goes with physically doing something like that. And professions taking the lead. I'm heartened by different faculties, whether it's from medicine to OTs to education to architects, doing something about mental health that leads in from their point of view, not trying to force our young people to go into something that's generic. I did mention this a couple of years ago when I spoke in Townsville to this forum, to the room. We have, like other places around the world, an authorising window that comes with a disaster and a pandemic. Collaborations can be made that normally wouldn't happen, and opportunities that often have been left on the shelf that are dusty can be activated now. Take the opportunity to not only improve the well-being of your students now, but systemic change for the future when there is no pandemic to worry about. For international policy, I wanted you to draw your attention to this. Better than me explaining Australian policy. This is the Youth Lab Recovery Plan from World Economic Reform Forum. It did touch on about 160 of the odd 190 countries in the world, so I can say that it's useful for everyone. Pillar 6 talks about mental health. Pillar 6 talks about, do those 20 odd thousand students around us around the world think mental health is human right? Yes, they do. And you can see the rest below that. Often it's about themselves, getting over themselves to ask help. The other part is, who would you turn to first? Now, forgetting the first bar, it's family, it's friends, it's internet, it's spiritual leaders, it's our general healthcare practitioners. Now, all of those people in the student body or staff body are on campus. All those cumulatively can have a protective factor for our young people. And in fact, our mature age students, I will not forget them, and the postgrad. Here are some of those things outlined again. I draw your attention to the right, where things were brought down into very detailed expression of what that means for making that recovery happen when there is a pressure point that becomes overwhelming, such as COVID or something more tragic. I want to do my last two slides in a shout out. Those thematic things were done by an organisation called Batia, which works for the lived experience, the storytelling of students on campus, which is well run in most universities in Australia. And I'm grateful that they connected with JCU, and that meet Alex at the bottom there from last year at JCU in Townsville. He got to share his story and is now part of that process. For adults and postgrad and other students that are mature age, I'd recommend looking into Roses in the Ocean. It's a lived experience storytelling piece for adults that will probably have correlations with stuff that's been done around the world. There's some great storytelling happening in places like Kenya and Ireland and in Canada as well. My last slide is a call to action from you, is that whatever you take from my today's session, that on this 10th of September, this week, on Friday and some other days for other countries, that you take the international theme for International Suicide Prevention Day, Hope Through Action, come together with your team and your students and other stakeholders and decide what you're going to do about COVID and the future. Take the opportunity of COVID. And at 8 p.m. your time, you sing the a hashtag so that we know we can connect with each other online, on Twitter, or wherever. Light a candle in hope for our students and our staff and faculty, in remembrance of those that lost, and hope for what we can bring about internationally for the future. Thank you.
Thanks very much, Adriel, for that really inspiring presentation. There's a lot of food for thought there for us, and some very, practical things, as you say, things that are pretty straightforward, really, that can be implemented to do something now about, the issues of student mental health and wellbeing. So thanks, Adriel, and yeah, a really terrific perspective from your role, and I think that there's interest in people having copies of your slides. So thank you for just noting that they'll be made available. So that's excellent. I think people want to be able to reflect on those and have an opportunity just to go over them. And yeah, I'm sure there'll be questions to you a bit later on in the webinar. So thanks again, Adriel.
Thanks, David.
Our third speaker this afternoon is Larissa Salazar. Larissa will be focusing upon the JCU student experience and the implications of COVID to their wellbeing and success. She'll also describe how JCU has responded and future plans through the development of a strategy to embed mental health and wellbeing into our core business. So thanks very much, Larissa. Lovely to have you this afternoon.
Thank you, David. It's really hard to be going after Adriel and the amazing Griffith team, so I'll try to do JCU justice. But before I start, I also would like to acknowledge the traditional owners of the land in which I'm based, which is the Wulguru Kaba and the Bindal people. And I do pay my deepest respects to the elders past, present and emerging. And I also acknowledge the amazing contribution that they continue to do, not only to our university, but also our community. So I'm going to have a go at sharing my screen, and hopefully I can do this properly. So hopefully you can have a look at my screen now.
Yep, that's perfect.
And I guess, yeah, that there are some similarities in terms of some of the stories that we have heard already from Griffith and even from Adriel, but this is a little bit in terms of our experience at JCU. So I guess in the terms of the first questions of, do universities have a role? Of course we do. And I think, it has already been covered in terms of, we do have some legislative requirements on the TEXA and the HISA Act and ESOS, and there's a whole heap of things. There's also a moral obligation. I mean, our students, our community, and also our staff. And I think we also have an obligation to look after and to make sure that we provide a safe place for students to study and people to work. But I guess the other reason is that we do know from the student experience survey that all students have to do, that issues around health and stress and other factors that impact on people's well-being, such as the need to do paid work, personal reasons, workload, they all contribute towards the student's capacity to remain engaged. So this is data from, as I said before, from the National Student Experience. And this is the top reasons why students will consider leaving the studies. So it's not necessarily why they will leave studies, but why they would actually consider stopping. And you would see JCU is in the blue, the orange is the national standard, and you would see that all these issues actually do play a significant role on people's capacity to engage successfully with their degrees. We also know that universities are not isolated communities. We are part of the general community in which we live. And we actually know that about 75% of people who experience mental disorder during their lifetimes will develop the first episode before the age of 25. So while we do have a really broad range of age groups and diverse backgrounds in our student body, we do know that we also have a fairly large proportion of the students that might be experiencing mental ill health for the first time as well. Another information in the slides, which will be made available as well, in terms of, we do know that about 2,500 Australians die by suicide every year, and that suicide is the leading cause of those Australians aged between 15 and 44. So this is part of our community, and this is why universities do play a role. We also know that for many university students, this is a critical time of transition, so ages between 17 and 25. We also know that students across all age groups do face financial pressures, and this was a survey done by Universities Australia in 2018, and there was also a 2017 survey when 1 in 7 domestic students said that they regularly went without food, and 3 in 5 domestic students said their finances were a source of worry. So we can't look at mental health just in isolation, but also all the compounding issues that are impacting on students. We do know that there's increased academic pressures around employability and competition, things that have already been mentioned by Heidi before around isolation and loneliness, potential loss of cultural connections, particularly for our Aboriginal and Torres Strait Islander students, is they do have to move away from their lands to be able to study. And we do know that students are managing multiple priorities. Some students have to study, they have family responsibilities, they have to work. And all those things can actually bring a big toll on their mental health. And while it's great to sort of continue on that discussion, and things like this really helped in trying to beat the stigma, and programs like Batia, which we are very proud at JCU to be working with Batia around trying to tackle the stigma, we do know that there's still some concerns for students around disclosing and around seeking for help, because the students don't want to be seen, as being different. These are some comments from our students at JCU, and I'll let you read. So I guess to me, this really clarifies the multiple things that can impact on the student health and well-being. So it might be something as simple as somebody missing a bus, then that means that they miss their class, and then that means that they get behind, all the way to trying to balance full-time work and part-time studies. We did have a cohort of students that were impacted by a death by suicide at home, and all these kind of things that constantly, can actually play on students' minds. This is what our data looked like in 2020. We saw about just over 1,000 students in our counselling and wellbeing services. That translated to just over 4,500 appointments. And one of the things that we do know is that community mental health is quite stretched as well. So by students and the universities providing students with free access to psychologists and social workers and occupational therapists, we're hoping to be able to alleviate some of the concerns that students have. But of all the students that we saw, about 45 students actually had to be referred to the hospital because of high levels of suicidality or risk to themselves. The main presenting issues were around anxiety, and a lot of them were actually related to COVID. Depressive and mood disorders, relationship issues, procrastination. We actually saw a little bit of an increase in students that were seeking support because of domestic and family violence, particularly students that were actually having to quarantine and isolate at home as well. And then COVID hit. And what a year 2019 was, and I think everybody got to December thinking 2020 will be different, and 2020 hasn't been very different, particularly if you live, in New South Wales, in Victoria. To a degree, we have been quite lucky in North Queensland. So with COVID, and I think, Heidi did cover some of these things, we did see increased isolation for those in lockdown and quarantine, and that loss of social connections. And what was very interesting for us is it wasn't just our international students, but it was also our domestic students who couldn't get to Western Australia, who couldn't come back, from visits in New South Wales. So that sense of isolation and homesickness was actually being experienced by our domestic students, but interestingly, as well by some of our staff that might have families living overseas or in different states. And before we took it for granted, we could just jump in a plane, and things are a little bit more complex. So I mentioned, the homesickness, the concerns for health and families' health. So we did get a lot of international students that were seeing the spike and the increase of COVID happening in their home countries, feeling quite powerless in terms of what they could do. And that general uncertainty, as I said, was mentioned before. The transition to online learning was a big thing. And it wasn't just a big thing just for our students, but for our staff, that in many instances had to change curriculum in 1 or 2 weeks into online learning. So I guess that resilience of our staff was also tested. And also for our students, many didn't have access to the correct technology. So maybe they didn't have internet at home. Maybe they had one laptop or one computer that all of a sudden they had to share with their kids who were being homeschooled. General academic stresses, family responsibilities, and this is something that we're still experiencing now. We have a couple of students a few students that are external. They're in New South Wales, homeschooling until October. So having to balance all that, where previously you might have been able to have that space to yourself, it's actually quite challenging as well. Loss of income, as was mentioned before, and as I mentioned before, the domestic and family violence, but also people, due to their financial pressures, having to move back home where there had been a period of time where they hadn't been living with family. So, all those relationship issues that can come up. In terms of the impact on the student experience, this was a survey that we did to students that actually attended counseling and wellbeing, and we had about 1,000 students return. So about 35% of the students said that they were severely impacted on the studies. We had about 6% that were actually completely unable to study because of the stress, the mental health, and the general well-being impact that things were having on themselves. So that's a fairly decent proportion of our students. So what are we doing and what did we do in terms of our response? I guess the first thing was that we needed to be responsive to COVID. So we implemented a student support package like many other universities do, and that included a combination of financial support, provision of computers. Our international support team ran the most amazing food pantry for domestic and international students, and they just did such an outstanding job in supporting the whole student population. Like Griffith mentioned before, we very quickly moved to telehealth across all of our services, so disability services, counseling services, careers and employability. So the students were still able to access support services without having to be on campus. The university also introduced an extenuating circumstances self-declaration. So that allowed the students to let the university know what was happening and how COVID was impacting on them. That prompted a pastoral care reach out phone call from somebody in the university, so we could see how we might be able to support the students and also make a social connection. We also developed some webinars and resources online, and also some support protocols for students in quarantine. So again, that included, dropping off care packs to the hospital, to the hotels, and also putting a phone call to students. We had to very quickly relook at how we delivered services around mental health to try to reduce waiting periods. So we introduced a TIA, a step program as well around that. And also we implemented half-an-hour intake appointments so we can actually connect with the students a lot faster and try to sort of give them some support and then triage them appropriately. Again, we were fairly lucky in North Queensland that we didn't get to experience the level of isolation and lockdowns as other parts in Australia and other parts in the world have. So we still were able to have some whole of institution initiatives to promote that well-being, inclusion and support. So we were lucky enough to still be able to do Ida Hobbit Day in Cairns, Are You OK Day in Townsville, for example, and some of the other student success weeks with a focus on early intervention for students that needed support. And I think the other thing that was really important is to still continue to acknowledge that amazing diversity that we have in our student population, both culturally and gender diverse as well. In terms of what we're doing, we are following the steps of so many other institutions, and we are going ahead and developing a JCU mental health and wellbeing strategy. We actually have working groups which comprises staff and students, and we're very keen on our strategy being student focused, but actually encompassing whole of institutions. So our strategy will not only look at the student experience, but also at the staff experience. We are definitely using the work that Origin did in terms of the recommendations that they did in terms of universities having a framework, and then looking at domains around the learn, so curriculum and pedagogy, embedding health and well-being in those discussions. Work, what does that look like for a staff to have a mentally healthy place, and how do we actually support them to be able to support students and themselves? Leave, so things around health promotion and visible leadership, which is going to be so important, and obviously the general and holistic support all the way from the provision of spiritual self-care to counseling services and having safe and effective interventions at different points. I guess the other thing is really important that we provide staff with education and resources so they can actually support students in the most appropriate way and in the most timely way. So I will leave you with a little bit more of the student voice. Now at JCU, we hold what's called an Inclusive Practice Awards, and I think it's the most amazing awards that we hold this year. These are students that are registered with our accessibility services, and they nominate staff, academic staff, professional staff. We've had security staff nominated before for the impact that what they've done has had on the student experience, but also on themselves. And as you read through this, it doesn't take much for us to do to make a difference to somebody's day, to somebody's life, and to somebody's academic journey. So it could be something as easy as just making sure that the student knows that our support and that we're here to help them. And it's always really quite beautiful when we get to the end of the year and we're able to hand out our Inclusive Practice Awards to staff that go above and beyond supporting students. Yeah, thank you so much for having me here today.
Thanks, Larissa. Fabulous presentation, and you've given a wonderful overview of the supports not only to students but the supports provided to staff, so that they in turn can support students as well. That really is so critical. And so, yeah, a terrific overview of how JCU is responding to, the needs amongst our staff and students, but particularly students in relation to mental health and wellness on campus and as part of this JCU community, wherever that might be. So thanks, Larissa. Wonderful presentation. And as you'll see in some of the comments in the chat, we're very sorry to be losing Larissa from JCU. She's going on to other pastures, but I think you'll agree she's a wonderful ambassador for the sector. And yeah, I just want to wish her well as she moves on to other things. But Larissa, again, thank you so much for your presentation this afternoon. Well, our final speakers this afternoon are led by Dr. Fortunato Cristobal, or Dr. Chris, as he's known. And as I mentioned earlier, due to the uncertainty around a possible the internet link, Dr. Chris and his team decided to put together a video for us. But they are here online and they're going to be talking a little bit and responding to questions, of course, afterwards. Dr. Chris is here and he's represented with his colleague, Dr. Monsi Guingona and Miss Mariel Gadangan. And they, as I said, have put together a video on the impact of the COVID-19 pandemic on a socially accountable medical education and training program, highlighting the Philippine experience. So really looking forward to this. I've seen it already as a bit of a preview and it's just wonderful. So sit back and enjoy this terrific video from Dr. Chris and his team.
Good morning and thank you for that kind introduction. Thank you too for inviting us to be a part of your webinar symposium. Our task is to share with you how a socially accountable professional education institution adapts to the COVID pandemic crisis. We will share to you our Philippine experience and with a special focus on a student caught in the crisis of this pandemic. When I first saw this logo, my thought raced back to say that this is exactly reflective of our medical education curriculum today. A curriculum with many pockets of teaching domain, often overlapping each other, while some exist in separate isolations. The challenge, of course, is how to integrate these pockets together and how to make simple that which is in essence actually a complex system. To me, I call this a paradox in pursuit. One of the major capstones that defines us is the concept of Judith Bowen, published in 2006, stating that the student organized their medical knowledge according to the structure of the curriculum they go through. Because of this, we were challenged first to make our curriculum explicit, simple, clear, fit for a purpose, and easy to remember and imbibe these values. The second important influence came from Dr. George Bordach, who said that the development of problem-solving skills does not only involve in the increase of knowledge content, but more importantly, in the way this knowledge are stored and used. This perspective led us to a radical shift from a knowledge content-based to a problem-based learning curriculum. Perhaps our curriculum can best be appreciated as likened to a triple DNA helix, with each strand representing the domain of problem-based learning, community-engaged medical education, and a competency-based assessments. All these strands combined together comply with the outcome-based education mandated by the Philippine Commission on Higher Education. But it also gave us a word picture for developing a logic framework. From the logic framework, we started to construct our teaching and learning strategies. Coming from a constructivist perspective, we adopted the following teaching theories: the experiential learning, the contextual learning, the longitudinal learning, and the distributed learning. From these theories, we developed our teaching strategies, and we encapsulated this into phrases that are easy to remember, such as learning by doing for the experiential learning, a situated learning aligned with future roles for the contextual learning, continuous iterative learning for the longitudinal learning, and the blended learning in mixed setting for the distributed learning. At this point, allow me to invite Dr. Monsi Kingona, our Deputy Dean for Curriculum Development, to share more details, and also Ms. Riel Kadaingan to share her research done during the COVID crisis. And at the end, we will share to you a 3-minute video clipping about our medical school. Thank you.
Capping the words of Dr. Judith Bowen, I will describe how our curriculum is designed. The ADSUSOM is running a 5-year course double-track MD-MPH program, which is best appreciated through the iterative sandwich model. The first 3 student years are spent mostly in the campus for the problem-working strand through the problem-based learning or PBL. At the end of every week, student goes to the hospital for their bedside sessions for the professional skills strand to meet patients presenting with the same clinical scenario as their case during the PBL sessions. At the end of every semester is the population strand. Here, students are engaged in an assigned community in which they will immerse in throughout the course of the 5-year program. At this point, MPH courses will also be introduced. On the second half of the 3rd-year level is for the hospital clerkship. This is to further hone professional skills. On the 4th-year level, the entire school year is spent in the community to complete the community, family, and individual health plans as well as their interventional research. MPH courses are also incorporated in this community engagement. Completion of these academic activities fulfill their MD requirements. The 5th year of the program is implemented into 2 parts, which are the hospital internship, where the students rotate in the different departments, and the community internship for the MPH thesis, as well as the community ambulatory care rotations, which will further complete their requirements for the MPH degree. This will make the students eligible to take the National Physician Licensure exam. Due to the COVID pandemic, several aspects of the curriculum were affected, especially the community and the hospital rotations, all highlighted with a yellow box. Modifications were made to still achieve the respective objectives for these rotations. As a result of the various modifications, we collectively had to start to shift our perspective to look at change, not as something negative, but an opportunity to improve and be better. We had to accept the reality that change is not an event in time, but rather it is a process, and that there is no change without resistance. This is the change adaptation processing model that guided us in assisting students and faculty adapt through the changes brought about by the COVID-19 pandemic crisis. The process starts with a transition phase, which is triggered by the onset of the changes experienced. This then triggers various emotional responses, which result to the second phase called the Valley of Despair, where the circle of chaos happens. Here, students start to feel the effects of change. The old teaching-learning activities are no longer applicable, yet the effectiveness of the alternative strategies are still unknown. This phase is dubbed as the hardest phase, but at the same time a critical phase for opportunities. The goal is to be able to transition the students effectively through this phase. The third phase is the phase of new beginning. Here, the students start to realize the need for change. As the change is being implemented, various emotional responses are expected. Currently, we at the ADSUSOM identify as slowly transitioning through the acceptance phase. I will walk you through the change adaptation process over time in context with the various activities we underwent during the COVID pandemic crisis. Soon after the World Pandemic Declaration, the Philippine government declared a national lockdown on March 15, 2020. Because of the challenges the faculty and the students faced, an academic freeze was declared where all school activities were put on hold. This sudden shift triggered the start of our change adaptation process we are currently going through. Consequently, this triggered bouts of emotional response as evidenced by a survey that was conducted among students to assess their perceived stress, which revealed that 26% had severe stress. 6 months into the virtual rendering of classes, a re-survey revealed that 35% were with severe stress. This was attributed by the rising COVID cases in the city. Also, a student mental health assessment was conducted and revealed that 19% had symptoms of anxiety and 24% of depression. These symptoms were significantly associated with COVID-19 related apprehensions and academic apprehensions. In addition to this, a mental health assessment was done among our faculty members that revealed 52% were with symptoms of stress, 20% with anxiety, and 29% with depressive symptoms. The highest frequency of these symptoms were seen among faculty with private clinical practice. 3 months after the academic freeze, all academic activities resumed virtually. In response to all this, the Students Mentoring Program was strengthened as an avenue to cater to students' needs, together with maintaining open communication and engagement with the students. Also, faculty capacity building activities strategic conversations, and mental health modules were also introduced. To look further into the students' holistic well-being that affects their mental health, a quality of life survey was conducted and done by one of our Level 5 students who will be presenting the results shortly. Just recently, we had been granted to resume restricted face-to-face clinical activities.
Good morning. I am Riel S. Gadaingan, a medical student, and I will be presenting my research paper entitled Lifestyle Habits, Spiritual Well-being, and Quality of Life of Medical Students During COVID-19 Crisis. This study aimed to determine the lifestyle habits of the medical students according to sleep quality, physical activity, and eating habits. In addition, it also looked into the spiritual well-being of medical students according to religious well-being and existential well-being. Thirdly, this study compared the sleep quality, physical activity, and spiritual well-being of medical students according to year level. Furthermore, quality of life was also assessed according to physical health domain, psychological health domain, social relations domain, and environmental domain. And it also looked into their perceived quality of life. Analytical cross-sectional study design was utilized and was conducted among Level 1 to Level 4. Total count sampling technique was employed, and 158 medical students participated. Data collection was done through an online survey. Demographic profile of the participants showed that students are somehow equally distributed per year level, while 21 to 25 years old, females, single, following Islam religion, and Tausug tribe dominated among the participants. The study assessed the sleep quality, and the findings showed that 61.4% had poor sleep quality. There was also higher proportion of Level 2 students with poor sleep quality compared to other levels. For physical activity, 51.9% of all medical students were physically inactive, and 16.5% were highly active. There was no significant difference across year levels. For their eating habits, the most consumed food were meat and grainy products, and vegetables or fruits, while the most consumed beverage is coffee or tea. For the spiritual well-being, 56.3% of the students scored moderate, while 43.7% scored high. There was no significant difference across year level. Religious well-being is the association of one's relationship with a higher power, while existential well-being is one's sense of meaning and purpose in life. 58.2% scored high in their religious well-being, while 69% scored moderate in their existential well-being. With a possible range of 0 to 100, physical health domain scored highest with a population mean score of 68.08. The psychological domain scored lowest with a population mean score of 61.28. Cutoff score of 1 SD below the population mean was computed to categorize low quality of life. Based on the range of scores, we can surmise that the medical students have a moderately good quality of life with mean scores above the cutoff score. However, there were still few students with low quality of life. 15.8% of the students with low quality of life scored lowest on environmental domain, which covered issues related to the following factors. Students answered the question, how would you rate your quality of life? And 14.6% responded they have a very good quality of life, and 67.1% perceived theirs was good, yielding a total of 81.7%. In conclusion, several medical students are poor sleepers, physically inactive, and moderately spiritual. They consume more meat products and less grain, vegetables, and fruits. Majority has moderately good quality of life. And lastly, students with low quality of life also had low environmental domain score. Our desire is still to continue with the vision and mission of our medical school past this COVID crisis, and it is on this context we look forward to going back to community to help solve the health problems in our region.
The goal and the mission and the vision still remain. In fact, we just simply added the word beyond because our graduates are now serving other areas beyond Region 9.
And it keeps me motivated more and still more because I could see our graduates in the community. And whenever I go to municipalities and hospitals, even here in Zamboanga City Medical Center, most of the residents are our graduates.
Ang daming nagsasabi na hindi nga kami magsasucceed, but we did in different fields. Ang dami namin na nagstay sa community, and then marami kasi nagsasabi na magpa-payback lang and then aalis din kami sa community, but marami din ang nagstay.
We journeyed in faith with courage and perseverance. I think that made it all.
I don't think it's the end of the road for the medical school because many more are still coming up. And we're still exploring and expanding new horizons.
It is a joyful journey of fulfillment. It's not about the game-changing, life-altering victories we had. It's celebrating the little victories with our students, with the medical school, to the past 25 years.
And that is the kind of relevant medical education that ADSU SOM has. ADSU SOM is a trailblazer of relevant education in this country.
Well, thanks very much, Dr. Chris, for that wonderful video and for the overview of that medical school and its curriculum, and also the research project that was reported on there by Mariel. Thank you for that. Some terrific insights into the experience within that medical curriculum within the Philippines. So wonderful that you can be online and joining us today as well. And Vicky Hutton, a colleague, has been monitoring the chat throughout, and she sent through to me some questions, and I'm glad that hopefully all of our panelists have been able to stay on. The first one, Pri, is actually to you. So I'm glad that Heidi and Priyanka are still there. There was a question for Priyanka, actually. Firstly, the participant wanted to thank you so much for sharing your experience as an international student and the Griffith Mate initiative there. In your presentation, you spoke about international students being cautious about taking the first step to connect with others since COVID. You got any thoughts about how to encourage students to take that first step when they've had to, physically, socially distance through COVID?
So I was thinking about, being a first year student and that concept of just going up to someone and saying, hi, this is me, this is who I am, how do I get help? Seems like such a daunting task. And I can't imagine that it's gotten any easier with most interactions being online. Everyone's just a name or a video on a screen. It becomes increasingly difficult. But fortunately, with my position mates, I've gotten to host and attend many events like our coffee catch-ups. And it's a chance where, yes, we're names on screens. Yes, somebody might be calling from a country that's 8 hours behind, and so it's nighttime for them and morning for us. But it's that chance to say, hey, I'm looking at you. Like, this is your screen. This is your chance. Talk to me. Tell me what's going on. How can I help you within what you're doing? I'm also a student ambassador with Griffith, so we have these chat forums where students can message us if that's something that they feel more comfortable with, because we recognize that not everyone is going to be comfortable to speak or show their face at our events. So, they can hop onto our platform, they can shoot us a quick question. And a lot of the times it starts off with something very simple. I'm having trouble logging on to my portal. How do I do it? And as you talk, by the end of the conversation, you're realizing, oh, so the student is from Sri Lanka, or the student is the first person in their family to go to uni. You learn more and more through that. And I think that's one way that we are helping some of our students connect. Very fortunate that we have the Griffith Mates program. I think that's probably the most important thing, is just encouraging students to get out there and take opportunities that come their way.
Thanks, Pri. It is. It's a challenge, isn't it, for not only international students to, when they've had to physically, socially distance so much, to just reconnect and redevelop relationships that perhaps have really taken a battering as a result of particularly the COVID pandemic. So thank you, Pri, for that response. It's excellent. Adriel, thanks for staying on and for sending through a copy of your slides, and we'll make sure they're made available. There was lots of really positive comments about your presentation, Adriel. Someone called it stellar. So, you're really raising the bar for us, Adriel. So, but a lot of affirming comments, Adriel, about and agreeing with your question, really, about our fit for purpose. How fit for purpose are we as an organisation, as a sector, to be able to respond to the needs of our really diverse student demographic. And you did mention at the end there, and Ben, one of your colleagues, he sent through his email address for Batyr. So Ben M at Batyr, BATYR.com.au. And Adriel, did you want to just pick up a bit of, just briefly, a bit of the work of Batyr? Do you want to speak to that specifically?
Yes, I'm not here. I will say I'm not here being anyone's drum. I'm just wanting to share examples of student wellbeing programs that enable students to speak their lived experience, whatever that is, in a safe way. Batyr is particularly good in Australia, but it has a global reach. And I'm mindful that from the 17 odd countries that are on today, that they might go well with doing some of that stuff in their neck of the woods. Well, I think we've got people from Colombia to Kuwait to United States to Bangladesh on today. So the Roses in the Ocean is similar. It's more about adults and more about mature people ready to share their story. But that's what it's about. And there'll be other things that come up in the future about ways in which students choose to express themselves. And so I put up Batyr in that I spoke to them 3 or 4 years ago. And then as a southern-based organisation in Australia, and I was pleased that they reached North Queensland. So likewise with Roses in the Ocean, something that they're going to participate in the International Suicide Prevention Conference. It's online in about 5 days. It's been broadcast from the Gold Coast. So either ways, but I think, you know, even what's happening there at Griffith, that is lived experience happening in action. It's peer support in action. What's happening in the Philippines is the research is lived experience in action through that research.
Thanks, Adriel. Absolutely, and Larissa picked up on a lot of this in her presentation as well, and you know, recounted a lot of her experience in, you know, engaging with staff and students here at JCU. And Larissa, if I can ask you a question that's come through. One of the participants would like to know if there are any findings that report on the experiences of students with disabilities and how they've coped in these COVID times. Anything you can feedback there?
Yeah, well, I do think that places like the Disability Clearinghouse in higher education are doing a little bit of looking into see how COVID impacted in the broader. But we do know that going into online learning was difficult for everyone, but we do have some students with particular disabilities that did struggle. So you know, students who are neurodiverse, students, you know, for some of them actually quite suited them, but for some of them they needed that sort of, you know, more active cues and that kind of stuff. Some of our students with hearing impairments, you know, so we did have a diversity of students, and I think what really did prompted the industry is to have a look at how we actually develop and implement reasonable adjustments. We obviously had to change very quickly in terms of the time adjustments that we did, particularly for on-course, but we were able, and I think most universities were able to work really quickly around working around extra time for online exams and that kind of stuff. But I do think that there's still a bit for us to go as an industry in terms of how do we continue to support that online learning. And obviously some institutions that have been doing online learning you know, for years probably have it better and they already have things in place to some of the institutions that had to jump into. And I think that the other thing that was difficult is students sign up for a particular mode of study that might suit them. So we did get a lot of feedback in terms of students, you know, feeling that they didn't sign up for online learning and it wasn't necessarily suitable for them. So I think, you know, there's been that kind of contention as well for them. But definitely I'll put the websites for the Disability Clearinghouse and also a couple of other places where I think as things come up, it will be a good place to keep an eye on.
Absolutely. Thanks for that response, Larissa. Dr. Chris, thank you and your team for that wonderful video and the research that was done. And yeah, I'd just like to just ask you about your perspective within the Philippines and how how you've, the key things, I suppose, that from your position there in the medical school, how you've seen your school come through in supporting your students through this process. What's the takeaway message, perhaps, that you've had, that you've learnt through these last, say, 18 months of this COVID time?
Thank you very much for this opportunity. I think the other details will be answered by Dr. Gingona. But what we are doing here is, since we are a small school and we are on problem-based learning purely, and we're rendering authentic, it was easy for us to shift from the tradition, from face-to-face learning and teaching to a virtual learning. So that was easy. It was just a matter of converting all of their modules into PowerPoint presentations. But of course, there are still other areas that are still to be strengthened, and we are actually learning from the situation where we can actually develop models by which we can teach physical examination, history taking, and the like. And the other medical schools in the country are very large. They have a population ranging from 200 to about 600. And that's where the problem crisis really comes. For our situation, we can have about as much as 1 student with 3 faculty ratio, that much. So we can actually really follow through the students, especially those with mental health instability, and we can closely follow them up. We actually went into heightening our mentoring component of the medical education. And we have an existing office of the student affairs who deals nothing but this component. The take-home lesson I would share is that communication is really important. Keeping in touch with the students, even virtually, is very rewarding, in the sense that you really can see the students respond and continue to. Sorry, I was on mute. Did you hear me?
Yeah, we heard all that. Thanks, Dr. Chris.
Okay.
Yeah, thank you.
I think Dr. Monsi can supply more details.
Yes, Monsi, thank you.
Thank you for that. And once again, thank you for the platform. And it's just reassuring to know that the challenges we currently are experiencing are practically the same across cultures and even across economic strata. So in addition to what Dr. Chris said, yes, we really are thankful for the students, our students who have taken up the challenge to look into their fellow students' mental health and, take researches that assess mental health, not just of the students, but of the faculty. And because of these results, we, like what Dr. Chris mentioned, heightened or strengthened our mentorship program by decreasing the mentor-student ratio. Initially, we were at one mentor per 10 students, but now we're like at 1 mentor and 5 students, and to just periodically keep in contact with the students. And also, I think right now we're trying to look at looking at factors that contribute to their ill mental health, but at the same time looking at their coping mechanism and strategies, and trying to see how the school can strengthen these coping strategies that are readily available, such as providing social support, providing spiritual support, and just really, again, embracing those coping strategies that are already inherent in the students as well as in the faculty. So probably that's how we're moving forward. And yes, we're still a work in progress. We're learning, and we think the opportunities like this where we can learn from other schools as well, and probably strengthen what we already have or we're currently doing. So thank you, everyone.
Thanks, Dr. Monsi, and thanks, Dr. Chris, for that. Well, our time is gone, and it's really gone in a hurry, actually, as we've listened to these wonderful presentations. And I just want to thank all of our presenters today once again for their wonderful perspectives and the many points that have been raised. So inspirational, very different sort of facets to this issue, and I guess different threads in this tapestry of mental health and wellness in higher education that we're all part of in some way. So I just want to thank you for that. And so thank you for participants who've joined in from far and wide, as Adriel highlighted there. We've got many countries represented today at this webinar, and I just want to thank you all in your different time zones for taking the time out of your busy schedules to be with us today. And I just want to acknowledge your presence and thank you for your many comments, your many questions, and hopefully we can build on these connections and develop further connections as we go forward. This session has been recorded and we'll be making that recording available on the ARMEC website. So look out for that, please. My appreciation, of course, goes to the ARMEC organising committee for their generosity of spirit in volunteering their time and their skills in preparing this second webinar in our series. I want to thank Vicky Hutton, also Dr. Hutton, for monitoring the chat and sending through your questions to me on your behalf to the panel members. I want to thank Eileen Siddons, who's been monitoring the Twitter feed as that's come through. Thanks very much, Eileen and Vicky. Now, participants, you'll be receiving an email in the next few days with the link to this webinar and a short survey. And so please, if you can take a moment to fill out that survey, it really helps us to assist our planning for our subsequent webinars. So just on that note, our next webinar is scheduled for March the 9th in 2022, so March 9 next year, and it's going to focus upon the mental health and wellness experiences of professional and technical staff within higher education. You see, we're focusing on different groups within the sector, and we're interested in their stories and how they are involved in mental health and wellness within the sector in which they work. So March the 9th, 2022 for that further webinar. But bye for now. Just want to thank you again for your presence, everyone. Want to wish you well. October, of course, next month, there's a lot of focus on mental health around our nation and perhaps in your own country. I know October is a strong focus for mental health in many countries around the world. So look out for those opportunities, engage with them, get involved, and we hope to see you again in the new year. So bye for now, and thanks again for your involvement. Bye, everyone.